Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Doctor Study tutorial. Our today's topic is about burn. It is a very important topic for surgery. It is very important topic for both BDS and MBBS examination. So let's start it. At first, we have to know the definition. Burn is an injury caused by the exposure to heat or flame. Burn is an injury, protein denaturation, and cellular damage in the skin caused by the extreme heat and cold, certain chemicals and radiations. Then the functional anatomy of the skin. Skin can be divided into two layers, the outer epidermis, 5% of the skin, and the inner dermis, 95% of the skin. Deep to the dermis lies subcutaneous fat, fascia, muscle, blood vessel, and lymphatics. Here is the picture of layers of skin. It is epidermis, dermis, and the subcutaneous tissue or fat. Causes of burn. The majority of burn in the children are scalds caused by the accident with the kettle's pans, hot drink, and bath water. Among adolescent patients, the burn are usually caused by the young males experimenting with the matches and flammable liquids. Most electrical and chemical injury occur in the adult. Cold and radiation are very rare causes of burns. Then the pathophysiology of burn injury. The most common organ affected is the skin. Burn can also damage the airway and the lung with life-threatening consequences. Airway injury occur when the face and the neck are burned. Respiratory system injuries usually occur if a person is trapped in a burning vehicle, house, car, or aeroplane and is forced to inhale the hot and poisonous gases. Inflammatory and circulatory changes. Burn produce an inflammatory reaction. This leads to vastly increased vascular permeability. Water, solute, and protein move from intra to the extravascular space. The volume of the fluid loss is directly proportional to the area of the burn. Above 50% of the surface area, the loss of the fluid produces shock. Other complications of burn. Infection from the burn site, lung, gut, lines, and catheter. Malabsorption from the gut. Circumferential burn may compromise the circulation to a limb. Circumferential full thickness burn to a limb act as a tonic-weight as the limb swells. If untreated, this will progress to limb-threatening ischemia. Immediate care of a burn patient. Pre-hospital care and hospital care. In pre-hospital care, ensure rescuer safety, stop the burning process, check for the injury, cool the burn wound, give oxygen. Elevation of the burn limb will reduce the swelling and discomfort. In case of hospital care, the principle of managing an acute burn injury are the same as in an acute trauma cases, like ATLS guideline. A for airway control, B for breathing and ventilation, C for the circulation, D for the disability, it's mainly neurological status, E for the exposure with the environmental control, and F for the fluid resuscitation.